My family and I moved from Boston to Washington, D.C. about 2 years ago. And if there's one way to test the healthcare system, it's to move. Not everything that could go wrong went wrong, but everything that you hear about certainly did happen to us. I had lived in Boston for over 20 years, and I had been going to the same doctors, and my family had been going to the same doctors and all of that, so I knew that I was going to go to a new city and I needed this history, and I didn't trust that the history was going to come with me electronically. And so I went to every single doctor in the area in Boston that I had been going to and got paper copies of my medical record, and that's what I brought to Washington, D.C. I was fully prepared for the fact that I was going to be with a doctor who was not using the same electronic health record, and that my records would not transfer. And my records did not transfer. When we got to DC, I went to refill a prescription that I had been on for years. It was a typical refill for me, but it was a new city, a new doctor, a new health plan, and a new pharmacy, and that's a bad combination. So I went into the pharmacy to pick up what I thought was a normal refill, and I was presented with an incredibly large bill. I experienced big sticker shock. This medication, I was going to have to spend over $500 every month to pick up. And I thought, well, that just can't be right. So I asked the pharmacist, does this need a prior authorization? And the pharmacist said, well, let me look. And they went and looked, and of course it did. And they said, would you like me to start that for you? Yes, that would be great, thanks. Thus ensued about 2 weeks of back and forth between the pharmacist, my doctor, and the health plan, me, making those phone calls. Probably 3 visits to the pharmacy when I finally picked up my medication at the right cost, but it wasn't my original prescription. It was a different therapeutic alternative on formulary that was at a different price. So I went to refill this prescription in January. It's the beginning of the year. I knew I was going to have more problems. And a day later, I get a call from the pharmacist telling me that the medication needs a prior authorization. And I said, okay, well, would you like to do that for me? At which point the pharmacist said, I can start it, but it would be really better if you called your doctor. So I did. I called my doctor, and she pointed me to the health plan. Now I'm calling the health plan to ask the health plan if there are other medication alternatives that don't require a prior authorization. And the health plan confirmed that this was the right one. It does need some kind of authorization, and explained to me how to help the provider get through the prior authorization. And I'm an educated patient on this, obviously, right? Like, I knew what I was hearing and what I was looking for. But most people would not have any idea what this labyrinth of process is about, or when it would end, or how to work the system. So I've been in healthcare my entire career, and in healthcare technology for most of that time. Now I'm at Surescripts, where I've been for several years, and we are directly focused on exactly the problems that I was experiencing as I moved from Boston to Washington, D.C. EHRs are exchanging clinical data, clinical records across systems. My data, if the right systems had been in place, could have been shared, and I would not have had to bring my paper records with me, right? Making sure that when you are at the provider's office, they're writing that prescription, they know how much it's going to cost based on your deductible, based on your point and your benefit. And they've got the therapeutic alternatives right there, so it's a quick discussion that they can choose the alternative, and the ability to see that that alternative might also need a prior authorization, and to kick it off right there. I know these things are possible. I know patients who are having that experience, and I talk about it with my providers. I look forward to the day when I go to my doctor and they prescribe something, and I go to my pharmacy and I pick it up, and that's it. That's it. It's all a known cost, and the prior auth is done, and it's streamlined. That day is soon.